as being suitable for most patients with both type 1 and 2 respiratory failure. This is a hollow tube with 2 prongs, which insert into the nostrils. It can then be secured in place by taping it behind the ears. The other end of the tube is connected to some oxygen tubing, which then attaches to the oxygen cylinder. Normally, on a ward, the tubing can be attached to an oxygen tap on the wall. You can control the flow rate of oxygen going through the device using a flow meter. The design of these may vary between hospitals, but in general, the centre of the ball or marker will tell you the flow rate in litres per minute. The alternative to nasal cannulae is to use a simple face mask. This is less comfortable for the patient, but can deliver slightly higher concentrations of oxygen. The oxygen tubing is connected to the plastic port at the bottom of the mask. The open side ports allow air to mix and dilute the oxygen, as well as allowing carbon dioxide to leave. The mask can then be moulded to fit over the patient's nose and mouth and is secured by an elastic band at the back. The adapters which vary the diameter of flow in order to achieve a specific FiO2. They range from 24% and 60%. The adapters are different colours and display the required flow rate as well as the estimated FiO2. The oxygen is connected up in a similar way to the simple face mask, and the mask is then adjusted to fit on the patient's face. Reservoir bag and one-way valves, which allow oxygen concentrations of 60 to 80% to be achieved. Once again, the oxygen is connected up and the flow rate is adjusted to between 12 and 15 litres per minute. The valve between the face mask and reservoir bag needs to be pressed in order to fill the bag up. It can then be adjusted to fit over the patient's nose and mouth, similar to the previous face masks.